I can't hear me yet, I know. There you go. Can you hear me?
Yes. I-
Amazing. Yay, I'm so glad I get to see you again.
Yes. Can you see me clearly? Like,
Yeah,
can
I
you
can
see?
see you clearly. Yeah, we're good. Yeah, so thank you for making time today. It's really wonderful to get this one-on-one time with you.
Yes. Thank you for making some time too. Are you
Yeah, my
still at
pleasure.
the Penticton?
I'm in North Vancouver right now.
Oh, okay. So you know some. Good.
Yeah. So how did you enjoy the event on Tuesday? Did you get something out of it?
Yeah, I was amazed with like more like older people like doing this job for a long time, you know.
Yeah. There's some people who are veterans. Yeah. And a lot of people interested in my courses have been doing massage for a while and they want something different. They need to work in a different way, or they're just getting bored of doing the same old thing and they
Yeah, I hear it. I have the same feeling.
right. Yeah. So tell me about your practice now. We have sort of 30 to 40 minutes together in that kind of time range. So I'd love to just get to know you a little bit more. So just fill
Okay,
me in
so
on your practice now.
I've been practicing for like a massage and Thai massage since 2011. I was practicing in Thailand first, and then I moved to Canada in Calgary. Now I moved to Montreal because of my husband's job. And I still do the same thing, and now even more full time because in Calgary I have two jobs. It's not too bad, but now it's like full time massage, and I kind of get to the point that I need something different.
Yeah.
But then I
Yeah.
try to speak with the career consultant to see what I want to do, but it's still like somewhat in healthcare. That's why when I recovering you last year through my NSPC association, and I actually
Yes.
tried to attend your class last year, last but then
Oh,
I didn't get email back from you because I don't know how the course work. Yeah, I think I
oh,
go the wrong platform. I think so. But
oh. Well, I hope there was just some like email miscommunication there because I try and get back to everybody who reaches out to me. So
I think
sorry I didn't
it's
get
not.
back to you.
So and yeah, and then I just like okay, I'm gonna try to stay in this thing and then see if how I feel about it, or I gonna completely like maybe quit the hand-on job, or I don't know.
Mm,
So
right.
but I do in the meantime, so people asking me and more about the lymphatic drainage. Do you work with people with even my existing clients, they gone through surgery, heart surgery, stomach surgery, knee surgery, but then they're afraid to get massage, and I don't want to sell myself because I don't have enough knowledge on that. I all been doing like a Thai massage, deep tissue kind of thing like that. So it's kind of strong massage, right?
Right. Yeah. So you're a Thai massage practitioner, not a registered massage therapist, is that right?
Oh yeah, yeah. I'm registered from
Oh,
Alberta and Quebec now.
oh, I see. But you focus on Thai massage as your main type of treatments?
Um, I have slowly stepped out from Thai massage now. I only do more just the therapeutics relaxing now because I don't know what I want step because I start to feel pain, but the most thing is I don't feel enjoy inside anymore. So
Mm,
that's why I feel like I need something
yeah.
different. Yeah.
Yeah,
Mhm.
yeah, I really understand that state. And I told you a little bit about how I came into massage during our event. And yeah, I
Mm.
was really feeling flat and like, I'm not loving this. This is not answering what I need. And then finding a population of people who were like, oh, this is so important to my healing. This really
Mm.
makes a difference for me.
Mm.
And, there was all the higher learning that I could do and going more into the surgeries and more into the different, stages of wound healing and all the things that came with it. I was like, this is fascinating. And it woke up that love of treating again. So I didn't feel
Mm.
flat. I didn't feel like bored. I didn't feel out of love with massage. And I really hear where you're at right now, for sure.
Because I
Yeah.
try to go on Pilates practice, but I'm not like, oh, I wanna teach people, tell them what to do, and I don't feel that. I kind of feel, I still that feel like touching and giving something, So instead of, oh, okay, you do this stretch,
Yeah. So you
yeah,
like the hands-on care. You like that aspect of,
yeah, I like
yeah.
aesthetic. I like the way that people came in aggressive and get out smiling,
Ah,
So,
yeah,
yeah, I had
yeah,
those all the time, especially this province. For people are
right,
really
right.
yeah.
Yeah. So you like the transformation that people go through. That's
Yeah, I
satisfying
do
for you.
feel like that, yeah. Mm.
Yeah. Okay, cool. So if you were going to think of yourself a year from now, what would
Mm.
your ideal vision for yourself be? If you could, kind of conjure up what would I love in a year from now for myself, what would that be?
You mean the job or myself with anything?
In relation to massage and how you're working, but also, your own state of being,
Mhm.
how you would like to be.
Um, I would like to be more open more to like to people who need help but doesn't have to get beat up, So and I don't have to feel exhausted and feel pain or like I feel wake up and I don't wanna go to work anymore. Yeah, even though
Yeah.
I still wanna help, but my body say no to it.
Yeah.
So yeah, I do see that in a year from now. So but I need something that transform me. Yeah.
Yeah. Yeah.
Mm-hmm.
I understand that. Yeah. So for you, like you still really want to be able to help people, but you want to help people who are actually going through something more and they're maybe presenting with something a little bit more complex. It's a little bit more interesting for you.
Mm-hmm.
And it's people who are really going through something, so you can help them with that. But it's also easier on your body. It's not so much of a stressor, and you wake up in the
Mm-hmm.
in the morning feeling like, oh, I get to go to work, yay! Instead of like, ugh, I have to go to work, like that,
When
right?
you see the name of the clients, it's like, oh, this guy gonna make me out of my body. So yeah,
Right.
yeah,
Yeah. So saving your body is a very important part for you, it sounds like.
yes. I feel
Yeah.
more and more because I've been how many years? The total of practice has been 14 years now.
Yeah.
And I'm in my 40, so I need something change as well. So if I still want to do this field, I want to see if this one gonna keep me going or maybe I gonna change to something else. So
Right.
if I
So
really, yeah,
you're kind of at a crossroads right now,
yeah.
right?
But
Yeah.
I don't see myself sit on the desk and working with the computer. So I don't see myself.
Yeah. So you're looking for something that would build on your skill sets that you've got now and
Mm-hmm.
keep you kind of in more of an active job as opposed to a sitting job. Like for
Mm-hmm.
you, an office job doesn't sound like it would really thrill you. So you want to still
Mm-hmm.
be moving around, you still want to be helping people, having your hands on people, but it's not hurting your body. It's
Not
not
beating
creating any
myself.
kind of,
Mm-hmm.
yeah, yeah.
Mm-hmm.
And you're not bored and you're not feeling like I'm just
Yeah.
not thrilled. Yeah.
Mhm.
Okay, great. Um, so what would you say the gaps are between where you're at right now and where you'd want to be a year from now? What's the gap in between that for you?
The year, you mean the gap between? I would,
Yeah, between where you're at now and where you want to be a year from
I
now.
probably, I see myself as slowly move into it. like I still probably gonna keep the clients that I usually do at the moment, and then slowly move to like a new group of the people. So and then I'm sure that a lot of out there people have nowhere to go. They have no knowledge, and even now, even just massage, even Thai or not Thai massage, people still don't understand what is it stand for.
Right.
So and if I can just open to another group of people that I can help, that would be great too. So and at least it's like I'm still in the same field. I still love massage, to be honest with you, but it just getting too much with the body, and it just get to the point that something need to shift from here. It's
Yeah.
not just a routine, the same thing over, and the knowledge doesn't go anywhere. So yeah.
Yeah. Yeah. So for you, it sounds like the gap between where you're at now and where you want to be a year from now is to be able to reach a new population who you
Yes.
can work with and that you
Mm.
can create some connection with so that you can start having them in your practice and you can start doing the work. Is that right?
Yes.
Yeah. Yeah. Okay, great. And then if I can give you something really solid for you to take away today, what would you say that would be? What
Can
would
you
the
say
key
again? I'm missing the word.
if you want, like, what would be your biggest goal for that I can give you today? What would be your key takeaway that you would something solid that you can take away from our conversation today? What would that be for you?
Uh, Today it will be the key of moving more in advance, care for myself and giving more for another community, maybe I would say. Like take your knowledge or even your conversation that you inspiration, I think. And could you gone through that? And I probably take like maybe to that point that I wanna transform like you did too. So
So I'm not totally sure that I understood you there. Can you say that again? Just repeat what you said there. I'm not totally sure that I
okay,
heard you.
so from the conversation today, if I would give you give me, I was just totally want to take the knowledge from you, if and want to take the new skill, new experience, new inspiration myself to move me move me from today to tomorrow.
Okay, amazing. I can definitely help you with that. Yeah. So I think what would be really useful then would be for you to hear about the program so that you know what is in there and
Mm-hmm.
then how it can help you move from
Mm-hmm.
where you are now to where you could be a year from now. Does that sound good?
Mm-hmm. Yes.
Yeah. Okay. So I'm going to share my screen so that I can go through this
Mm-hmm.
program with you, and then we'll help you see where you can fit in this and if it's a good if it's a good program to help you move from where you are now to where you want to be. So this is the Mentorship and Training Academy for Breast, Chest, and Oncology Massage.
Mm-hmm.
And here we're we're helping you get on the ground results so that you can actually make the change that you're looking to make in the world. So our prime focus is to support your professional development with real avenues for real change. And you're going to get hands-on experience with live breast and chest surgery patients because it's really important if you want to make some change in your life that you're actually getting traction on things so you can make the changes that you're looking to make. Now we've got three key areas of focus in our practice in this program, and we'll go through what you get out of each of these three. So this is kind of a high level view here. So in terms of the technical training, you learn everything you need to know with light touch treatments to treat people going through breast and chest surgery and breast cancer treatments, because I know you mentioned oncology massage is an area of interest for you. And post-surgical massage is a lot easier on your body oncology and post-surgical, they're both way easier on your body. It's way lighter touch. Now, I do believe in science, so everything is evidence informed, and you get a lot of clinical skills that you can take into your practice and you can apply right away.
Mm-hmm.
We also help you with the marketing and communication because, you were saying you want to be able to reach out into the world, to be able to find this new population that you can help them come into your practice. And
Mm-hmm.
that's what the marketing and communication training does. It helps you present yourself to the world, helps you create those community relations so you can reach out to the organizations in your area and start letting them know, hey, I'm here and I'm doing this work and I'm available for people to come in. And then you can create those referral relationships and have that trusted relationships with people in your area. We also focus on a supportive community because when you're trying to make change, if you're doing it all on your own, it's a lot harder and a lot slower. But if you're within a supportive community and people are all moving in the same direction, then your movement is way faster. The change that you can make is way faster.
Mm-hmm.
So the support comes in the form of myself as your mentor, and
Mm-hmm.
then the other mastectomy guide peers who are also in the group, all educated therapists, all interested in higher learning, and it creates a very enriched atmosphere in which to learn. So those are our main three focuses for the program.
Mm-hmm.
In terms of the level of support, the support is really critical because we want you to get, actually be able to make the change that you're looking to make. So we've got 4 levels of support. The first, of course, is the mentorship. So this is the organization by the leader, the direction, feedback on your treatments. So you can, you can ask me, oh, I've got this patient who is going through chemotherapy and she's got tingling in her hands and fingers. I want to know what I can do, and then we can talk it through. Or you can show me a treatment. We get people to send in videos, and then you're like, okay, this is a patient. She had a lumpectomy. She's 2 months past her surgery date. This is my treatment. And then I review the treatment and I give you individualized, personalized feedback. So the whole thing, the mentorship is within everything, the whole program. You've got your peer group. They're all educated professionals. You can call on them for help. You get some accountability buddies, and that is what helps you really keep on track with all the tasks that are needed in order to make the change that you're looking for. So the buddy, you're assigned a buddy. You get 3 of them throughout the program. And each buddy, like, you work together and you say, okay, so this week I want to be reaching out to the breast cancer support groups in my area. And your buddy will say, oh, okay, awesome. What do you need to do in order for that to happen? And, you can support each other along the way. And then you reach out and they're like, oh, awesome, you did it. So you've got this person who's with you to help you actually execute the tasks that you need to. And then you create some friendships and some good bonds with them as you're going through as well. And there's the private community. Private community is only available for people who are in the academy. And there's different activities that are in there. You can message each other. You can catch up on video recordings of the classes. If you miss a class, then you can, just go back and watch the recording. So the private community is available all the time. People are in there all the time and communicate. So we really make sure that you are supported as you're going through the program, because when you're looking to make some change, it's really important that you've got people behind you who are cheering you on, who understand what you're going through, and who are behind you to help make the change that you're looking to make. So in terms of impacting your community, one of the things that we want is for you to make a difference in your local community. So you can form alliances, you can form networks with people who are in your area. You can give some presentations to a group. So maybe there's a, breast cancer support group at your local recreation center, and you can go in and you can do some self-massage tips or, breathing exercises or something to do that will help them heal and can help promote your practice. We help you participate in different events that might be out there. So maybe there's a dragon boating event, or maybe there's a pride community if you want to get involved with people going through gender affirmation surgery. But we just get you involved in different events that are happening so you can spread the word and let people know what you're doing. And then also we help you reach out to doctors and surgeons, other healthcare professionals, so you can create those referral relationships and then become known in your community. Okay, this is a person, Chayada's doing this work. She's gone through this training. She knows what she's doing, and it's okay to send patients to her so that they can get the help that they're looking for. In terms of how the program is laid out, the technical training, which we'll get into in a moment, but the technical training, it teaches you all about the surgeries. It teaches you about the complications, about working with chemo and radiation. That goes on every month. There's no month that goes by that you're not getting some kind of technical training. In terms of the mentorship part, we sort of split it up. So the first half, because it's a 6-month program, so sort of the first half, you're working with practice people. You're getting real hands-on practice, and the people who are in the academy right now, they're getting an average of about 5 practice people in the first 8 weeks. So, and then sometimes they're doing multiple treatments with people. So you're getting a good amount of hands-on time, which is really cool. We're helping you get your marketing organized and creating some marketing assets, like having your business cards, your brochures, social media, posting schedule, newsletters, like all of that we're helping you get that organized. So then in the second half of the mentorship, then you're really starting to reach out to the community around you. You're creating the connections, you're doing your presentations, you're starting to charge for treatment. And we want you to start charging for treatments while you're still in the program, so that you can have the guidance that you need while you are still under the mentorship. You still have that mentorship support, because the difference between how people perceive you when you're a full professional as opposed to doing a practice session is quite different. Like the level of expectation is different for when it's a paid treatment. So we want you to make that transition from doing practice sessions to doing paid sessions within the program. And then, because people present at different stages of healing. So someone might come in and they're 8 weeks past their surgery, and you need to know, is what I'm doing safe for somebody at 8 weeks versus somebody who comes in and they're 5 years past their surgery, and what you're going to do with them is different at 5 years. So we want you to have that the mentorship and support available, so that you're clear with how you can work with people in the different stages of healing, and also between doing it as a practice session versus doing it as a paid session. Does that make sense? Okay, grand. So in terms of the technical training, this is the comprehensive breast and chest surgery training. And you get 4 courses within that. So the first is your foundation. And this is everything you need to know for doing therapeutic breast massage. It gives you all the language to use, how to do the assessments, how to do the treatment, how to do the draping. If you're wanting to, you need to know the contraindications and the precautions, how to position somebody depending on which stage of healing they've had or what type of surgery they've had. Like all of that is covered in the foundations. And everything that I do is always blending the art and the science of massage together. So you're not only getting all the scientific evidence about what we're doing, but you're also getting mindfulness training so that you can approach things in a very mindful way. And doing mindful treatments is one of the ways that you can reduce the amount of strain on your hands, because it creates a lot more effect in your treatment than if you're sort of vacant in your mind and your hands are just on automatic pilot. And so all of that is covered in the foundations. When we get to level 1, then you get 18 types of breast and chest surgery. Now, most of them are related to breast cancer. Some of them are elective breast surgery, and some of them are gender affirming top surgery. And that's a good deep dive. So you really understand what's going on underneath the skin. In level 2, we talk about this is when things are getting complicated. You know, somebody shows up with a seroma or a hematoma, or they show up, they've got necrosis or, you know, other things that are happening that are very complicated. We teach you how to work with that. And, you know, if there's a few things that are outside of your purview as a massage therapist, you need to know, when do I refer this on to medical care? And if I don't need to refer them on, what can I do? So it really gives you confidence that you can treat the whole spectrum of what people walk through the door with. And then the integrative cancer care, this is where you learn about the stages and the type of breast cancer, how to work with people going through chemo and radiation, how to do it all safely so that you're not compromised, they're not compromised, everything is all clear, and you've got all the technical training that you need. Does that make sense so far?
Yes. I have a question on the practice with the body. It's like
Yeah.
in the first half, I have to find actual like people who actually had the cancer to practice on.
Yes. And we help you. We help you
Okay.
figure out how to do that. So we give you places to go that you can reach out and find people. We give you templates for language and wording, so you can just copy and paste. We give you images to use so that you can put it on your social media or include it with your email. So we fully support you in how to get the practice people, but it is up to you to actually reach out and get the practice people. But so far, everybody has been able to find a practice person, and most people are averaging about 5 in the first 8 weeks. Pretty cool.
Okay, and then we also have to charge them with the even we practices on them, right? Is that the second half? That's or the first half, basically we just have to do them without charge, or
Yeah, the first half you're just practicing so that you're getting a sense of what it's like to work with the people, and it takes the pressure off of you. So if you want to have videos present because you learn the techniques through the treatment videos, you can be playing the videos during the treatment. You can have your books open, and it just gives you full permission to be a beginner, and you're practicing. They know you're practicing. There's no charge for it, so there's no expectation that you're going to be able to help them through, because they know, okay, this is a practice session. And then yeah, the second half we get you to start charging for it. Yeah.
and because I live in the province of French
Mm,
speaking,
right.
so yeah, so I don't speak French myself, but I'm gonna try to find only the patient that's because here people speak bilingual.
Right. Yes, Montreal.
Yeah, and the
Yeah.
French is, right now they really strict with the French.
Yeah. So I don't speak French. I can't help you with the French part, but what you could do is you can take the scripts that we give you, and then you can put them into a translating app, and then you could get the app to translate it, and then you could put it out that way.
No, then I won't be able to communicate with them in French either.
Yeah,
I don't
that's
speak.
true. They
So,
would
but
write
I'm
back in
trying to
French.
think is free. It should not be regulated with it. So yeah, try to see that it's like if I go ask for the patients that have breast cancer, and then because I got reached out from a hospital, but they reached me out in French, so I didn't answer them because I
Mm,
don't know. But then I speak with some nurse that who work there. They said patient is English, but the head they want French, the leader or whatever. Yeah, so
right, right.
they probably
Yeah,
said they want French, but I think I should be able to get through that.
yeah, yeah. I hope so. And you're gonna, yeah, I mean, that's just a challenge of living in the part of Montreal that you live in, because I know some parts of Montreal are more English speaking, some parts are more French speaking. So it
Yeah,
sounds like you're in the more French
I
speaking
live
part.
in the English speaking. So
You live
we
in the
also
English speaking
have
part?
pardon me?
You live in the English speaking part?
Yes, yes.
Oh, okay. That's good. That's that's
Otherwise, I won't
helpful.
be able to survive.
Yeah, yeah. Okay, so let's go into some of the other things that you're going to learn. So in terms of marketing, we help you with being able to actually put yourself out there to get these patients in. And we do different marketing workshops so that you're learning some marketing skills. And the first one, we call it Nurture, and it's all around what we call feminine marketing, which is creating relationships with your person who you want to work with. It's not so much about like, buy now and do this now and that kind of old school marketing. It's more like we're getting to know you, we're we're showing ourselves as authentic people, we're creating relationships with you, and we're helping to sort of foster that sense of trust as you are connecting with people. And because I have a very practical side to me, I like people to walk away with something solid and substantial. So in this, we give you an activity for a welcome package that you can send out to your new breast and chest surgery patient. And you just need to personalize it with your contact info in there. You can put your picture in there, but otherwise everything's all done for you. The second workshop we call Create, and this is where we help you learn about the digital platforms that you can use for marketing. So if you want to do your social media or you want to do your newsletters, then you can introduce yourself to the world. You can share what you're doing. You can nurture those relationships with your ideal clients. And then, of course, you can help promote your practice so people know this is a person that I can go and see to get these types of treatments. And then we help you, we give you some brochures and some business cards that, again, you just personalize. You just put, Chayada Jatuten, is that how you say your last name?
Yeah,
Yeah. Yeah. So then you would just put your own name in there, your contact info, and everything's ready to go. And then you just get it printed and sent to your house.
mm.
And then the third workshop, we call it Build. And this is where you are creating the systems that's going to help support your business growth. And we help you with a schedule so that you don't have to be thinking every single time about what you're marketing. So you can create a calendar that has everything on there. So you can say, okay, on Tuesdays, I'm going to promote or educate people on different techniques that I'm using and why they're helpful.
Mhm.
On Thursdays, I'm going to talk about the different treatments that I have. And on Saturdays, I'm going to help them with some positive affirmations so that they feel, good about what they're going through. Or you can tailor it how you want, but it gives you a sense of, sort of laying it out ahead of time so that you've got it all clear in your mind what you're going to be talking about. And then you don't need to be thinking about it every time. And maybe you're going to be doing your marketing once a month and you sit down and once a month you figure out, okay, so in this month's newsletter I'm going to be talking about treatment that I'm doing. I'm going to be sharing a story about a person that I helped, and I'm going to be letting people know where they can find me. And
Mm.
then you have that all kind of organized ahead of time, and then you can send it out and it doesn't it takes the stress out of marketing. So that's the third workshop. We help you get that organized. Now we're also doing digital technology training. So for this, these are all the digital platforms that you can learn on how to actually, create a modern business. Because if you want to create change, you want a sustainable practice, then you're going to need systems in place to help you do that. And there's lots of digital systems that we help you with. So you can create some tracking forms. Well, we create tracking forms for you, but we help you learn how to work them in the Google Docs, the Google Sheet, the Google Forms. We help you with an online booking platform called JNAP. Do you use JNAP at all in your practice?
I use the local platform called Rendezvous, which is for massage and osteopaths.
Okay. Yeah, so then you can just adapt what we're doing with JNAP to the system that you already use. So we give you like treatment descriptions and after you book, this is what you can
This
say.
is the
And
booking platform, JNAP, right?
JNAP is a booking platform. Yeah, it's wonderful. It's so good. Yeah,
This is
but you don't have to use it.
Okay.
Yeah, some people use it. Most people use it. Some people have a different platform that they use. So if you have a different one, you can just adapt it to whatever platform you use.
Mm.
In terms of marketing, we help you with the Canva and MailChimp, Meta, which is part of Facebook and Instagram, and ChatGPT, so that you are able to put your marketing materials together. And they're not that complicated, but we do help you learn how to use them. And then some systems for our mentorship program as well, like Kajabi and Dropbox and Zoom and things like that. So you do get training as you work your way through. It's not too complicated, but it may be a few platforms for you to learn, but all of them are supportive of your business going forward. Does that seem clear so far?
That's good so far. Some of them I have been using for my business. I practice for myself, so I build my own website. I build my everything, so I kind of use some.
Amazing. Okay, great. So then some of them it's going to be really easy for you, and then you can just hit the ground running, and then you know how to, like, you can import the templates that we give you, and then you can use it for your own practice going forward. So it's not going to be too complicated for you to learn these then, which is great. Yeah.
But I have never used a GPT yet. So the chat GPT, I heard about it, but I'm kind of scared about it, but I'm gonna try.
Yeah. So we give you some prompts that you can put in there so that you can get the kind of language back, which is helpful. And and then you can use it to help create your newsletters and create your social media posts. And yeah, it's a pretty useful tool for sure. So in terms of the cost for the Mentorship and Training Academy, the regular pricing is $800 a month for 6 months, plus a $500 commitment deposit. So the registration fee is $4,800 and then a $500 commitment deposit, or you can pay in full, which is the $4,800 plus the $500 commitment deposit. But since you're in this call right now and you're doing it early, there's ways that you can save on that, which I'll share here. So right now you're in this early bird VIP period, which is valid for a little while longer, where it helps you save $1,000 on your course registration fees. And then if you decide you want to pay in full now, then I'll waive the $500 commitment deposit as well. So you have the potential to save $1,500 by getting this early bird VIP and paying within the 24 hours, 24 to 48. Got a little bit of flexibility on that. So instead of the 4,800, this is the regular price, 4,800 plus the commitment deposit if you're going to do delayed payments, which ends up being 5,200, then you would only have to pay 3,800 overall if you were to pay in full now.
Oh, so it's if it's the same thing, right? The paying monthly or paying the full after 24 hours, the
So
course
you
fee.
could, yeah, like if you were to do the monthly payments, then you would do your commitment deposit, which shows that I'm saying yes, I'm reserving my spot, I'm keeping myself in this opportunity, and then I'm just going to pay monthly over time, and I'm going to commit to continuing with my monthly payments. That's your commitment deposit. And same story, if you want to pay in full, you can do that. But if you don't want to do it right now, you still want to secure your spot, then the $500 secures your spot. And then you can you can do your one full payment later on. But if you feel like, okay, I just want to do it now and I want to get my maximum savings, then you just do, like, instead of doing the delayed, you just pay now, and then I'll waive the commitment deposit because it's not applicable to you anymore. And you also have this opportunity to save the $1,000 on your course registration fee. So then overall, you're saving $1,500 off of your investment.
Mm-hmm. So this is the plus the BC tax.
Yes, the tax is not included, so the tax is on
Okay.
top of that. Yeah, the GST.
So 38 plus tax, something.
Yes, so it ends up being, I guess, four
It's
thousand and something after
because I
tax.
don't pay a BC tax, so I only get GST maybe, or I have to pay BC tax.
Yeah, well, I have to charge tax because I'm a BC business, so I have to charge GST. Yeah,
Okay, yeah. So
yeah, but I think GST goes all the way across Canada.
yeah,
I don't think
GST, but the BC have HST or PST or
PST. Yeah, I don't have to do PST on it,
oh
just
okay.
GST.
So okay,
Yeah,
just GST, yeah. So then
just the GST. Yeah.
okay, and then how do I pay into that if I would like pay?
Yeah. I have a link that I can send you, and it's got the, like, it's just direct, so it's got the discount already embedded within there. And then it would, like, if you feel like I just want to do this now and get the most amount of savings that I can,
Okay,
then it would just skip the commitment deposit phase and take you right into the course registration phase.
okay.
Yeah.
And can I ask about the course or the timing because
Mhm.
so because that's the most important actually.
Yeah, that's important. Absolutely.
Yeah. So like the first is like once a month. Like it will be like every
It's
the day.
about
Okay.
three to four times a month,
Okay.
mostly on a Monday
Okay.
and sometimes on a Saturday. So we've got two lengths of days, basically, all the technical training. So that's your foundations, your level 1, level 2, and integrative cancer care. That happens from 10 a.m. Pacific to 4 p.m. Pacific. So for you, that would be 1 p.m. Eastern to 7 p.m. Eastern.
Okay. That's
And
mostly for Monday, right?
yes, that's
And
mostly
what
on a Monday.
okay. And what is
And
for
that
to Saturday?
the Saturdays, there's a opening ceremony and a closing ceremony. Those happen on a Saturday. And then I think there's one or two stat holidays in there where normally we would have a training session or a mentorship call, but instead we're going to do it on the Saturday. So the mentorship calls are a 90-minute call from 1 p.m. Pacific to 2:30 Pacific. So for you, that would be 4 to 5:30 Eastern. And that's where the mentorship calls, they're group sessions, and that's where we help you with your marketing, with your community reach out. We go over your practice sessions so you can talk about what you're experiencing with your practice people. We give you mindfulness training. So those are shorter. So we alternate between the longer days, the longer technical training days, and the shorter mentorship calls. So mostly they're on a Monday. So you want to keep Mondays available in your schedule. And, if you need to change your work schedule around a little bit, you've got some timing right now because it starts in September. So you've got a little bit of time to alternate your work
Okay.
schedule if you need
So
to.
basically every Monday, so except the day that I have holiday.
Yeah, most Mondays. It's at least 3 Mondays a month, sometimes 4 Mondays a month. Yeah.
And do I
So
have a schedule that ahead of time? A
yes.
little bit?
Yep.
Okay.
Yep.
So,
You get the schedule, you get the dates of when you're learning the different surgeries, the different materials, so that when you are organizing your practice bodies, then you know how to schedule them for your practice sessions. So in the beginning, we say, the first month, we only want you to do therapeutic breast massage with people. And that's, you don't need complicated surgeries, complicated cancer cases in the beginning, but you've got your schedule for your training. So on this day, you're going to be learning about these types of surgeries. On these days, you're going to be learning about chemotherapy. We lay it all out for you. And you also have the date of these are the training days, these are the mentorship days, and like you have all the dates ahead of you so that you know how to schedule yourself. Yeah.
Okay. So I can just organize.
Pre-organize. Yes. Really
So
important.
at least I have time until September. I can prepare ahead of time. So
Yes.
yes, I think you think can I do it?
Yay! Oh, I'm so excited. This is going to be good for you.
I a little bit worried because I talked to my husband about it and he said like, are you sure? Because like he worry about more is my language that I'm not gonna be able to understand all of them. But I think if I don't do anything, then I'm gonna be the same thing. Do the same
Yeah.
things.
Yeah.
Just-
Yeah, because making change on your own is really difficult. And if you just keep doing the same thing that you've been doing the whole time, you're not going to get anything different out of what your day is like. You're just going to have the same kind of day. And it sounds like you're in a place where you're like, I need to make some change. Otherwise, I have to find a new profession. Right. Yeah. I really understand. I do. And that's how I ended up in this line of work myself. And like, I didn't even think I would get to 5 years. I thought at 3 years, at 4 years, I was like, I'm going to have to quit. There's no way that I'm going to be able to continue. And now I'm 13 years later and I'm still working. And I was like, that gave me an extra decade out of my practice. And I still have another 10 years in my practice for sure. Like, there's so much more to learn. So I at least extended my career by 10 years by working with this population, which is amazing. And if I can do it, anyone can do it, because I was facing burnout almost right away. And now I'm like, oh, look at who I get to work with today. Oh, this patient's so interesting. And I don't have any pain anymore. My hands feel totally fine. Yeah, I mean, it's definitely a good longevity practice.
Are you still practice with like a regular patients or you only focus on?
A little here and there, not much, really, not much. Like sometimes someone will come in and I feel called to help. So I'm like, yeah, I'll help you out. But mostly it's all breast and chest surgery patients. Yeah.
Okay, you practice for yourself or you work with the clinic?
I work in a clinic now. I was working from home for a lot of years. I started in a clinic and then I worked from home, and then I moved houses and I wasn't living in a place where I could work from home anymore. So I've gone back to a clinic. Yeah.
Okay. And how many did you take for the patient? Like, how long did you work with them? It's like a regular, like an hour or?
Like the length of treatment?
Yeah.
first treatments are usually 75 minutes so that we have a little bit of a longer time to do our intake and our history and assessments and all of that. And then subsequent treatments are often an hour, but sometimes they're longer. Some people need 75 minutes, some people need 90 minutes, but I don't do less than an hour. I don't do anything shorter because one of the things with the light touch treatments is often they need more time in order to make the changes in the body. And so you have to hold things for longer. You stay in an area for a longer period of time. So you need more time rather than less time. Yeah, in your treatments. Yeah.
Yeah. I understand. Yeah. Yes. Excited.
Yeah, I'm excited too. This is great.
Yeah, because I think I'm a slow learner, so I hope I'm not gonna make people behind in this class, you know.
Oh, okay. Well, here's something which is really good for you because you have 6 months in order to integrate the material. So, when you take a normal weekend course, it's like, here's all the information. You have to learn it right now, and then you're gone and you can never ask questions again. But because the information is being dripped out over time, then you're able to integrate it. So you can learn it, you can integrate it, you can practice it, and then you're moving on to the next thing. And also because the classes, they're all live taught like we're doing right now, but we also have recordings. So then if you want to go back and get a refresher on a lesson, you're like, I want to go over what a breast augmentation was again, then you can just go back to the recording and watch it on your own time. So it's got flexible learning that way. So for you, if you need a little bit more time to integrate the material, then that's just built right into the program. Yeah. So that's actually going to be good for you.
And after the finish the program, if I have something that I need to ask, I'll be able to reach out with the community.
The community itself is available while you're in the program, the private community, but you're definitely going to create bonds with the other therapists that are in there. So then you can continue to talk with them after the program ends. But if you feel like I'm not ready to let go of the mentorship part, I need to keep in that environment, then you can just re-enroll for the next time it happens, but only in the mentorship part. Like you don't have to redo the training unless you want to, but you could just roll over the mentorship part and then you stay in the mentorship calls and you can get review on your practice sessions and or you'll be doing real treatments on real patients. I mean, not real, like paid treatments at that point. So yeah, you can roll it over if you want to and stay in the mentorship side of the program for the cohort afterwards.
Great. And I think it's about time. Okay, yes. I think I'm gonna do it. So you said you're gonna send the link.
Yeah. So do you want to do the full?
Yeah, I just gonna pay so I don't have to think twice.
Yeah. Okay. Amazing. So I'll get my assistant to email you. So you'll have an email with an overview of what we talked about today, about what the program is, and then the link to register. And you can do it within the 24 hours or 48. I can give you up to 48 too.
48 might be better. Yeah.
Yeah.
So I don't rush into it. Yeah.
Yeah. So then we'll send you the link and then it just goes straight into the registration and then your spot will be secured and then we will be working together in September, which is so exciting.
Yes, me too.
Yeah, this is great.
Work on a schedule. So Monday and Saturday. So the schedule will light out before, right? Especially, I'm just a little bit worried on Saturday, because it's a busy day for me. So
yeah, there's not that many Saturdays. Mostly it's a Monday. There's just a few Saturdays. Yeah.
Yeah, I can take off Mondays, no problem. So
okay, great. What's your current work schedule? What are your days?
because I work for myself, I try not to take it, but then people say, oh, I'm so in pain, I'm jump in because I'm 5 minutes from my work and my home.
Right, right.
I'm
So you kind of,
burned out, like I really burned out. So I say to myself, I want to work 5 days, I end up with 6 days. And so
yeah.
I say, I'm gonna work 5 clients, I end up with 6 clients. And
Right. So you keep on going over. You keep
yeah,
going
and I
over.
just like, oh my God, I can't keep doing it. And I want to do it long time, That's
Yeah.
I can't do it if I what I do right now. So it just
Yeah. I understand. And one of the things that we help you with is those boundaries, like to be able to say no sometimes. And these are my treatment hours. And, if you want to get in, well, we can put you on a wait list, or like we help you with your boundaries so that you're not burning yourself out. Because, like I was saying at the event on Tuesday, we need to
Mhm.
make sure our helpers are in a good state. Otherwise, the helpers can't help. They just get burned out and then nobody wins. So, yeah,
Yeah.
we help you with those boundaries so that you can stay in a good state and you're not burning yourself out and you're able to continue your career for many years to come. Yeah.
Yeah, so yeah, I have kind of plan as well because my friend back in Thailand, they're doing the energy healing with the kind of what is it called? Like a retreat. So if I would be able to bring this my knowledge matching with them, so I kind of half year go home, be with my mom, and half year be with my husband in Canada. So,
Right.
so
Yeah. Well, it sounds
yes,
like you've got some opportunities there.
yeah, yeah. So that's why
Yeah.
I think I'm just gonna enroll it, so I don't have to think about it anymore. Just keep going.
Yes. Yes. I agree. I think that's wonderful. I really support that. Yeah. Because then you got your future, it's all secured, you know what you're doing and you can organize yourself, and then this time next year, you're going to be in a very different state than you are right now. Yeah.
Mm-hmm.
Yeah.
Yes, for sure. Yes, excited. Yes.
Yay. I'm excited too. This is good. Yeah.
Thank you. But the Tuesday it was a Tuesday? Yeah,
Yeah. It was
Tuesday.
Tuesday.
Tuesday was really, really good. I really impressed with everyone there. Just like, wow. I wish I could be 70 and still helping people. you know?
You might be. You never know. You might
Yeah.
be.
Yeah.
Yeah, you're learning a new way to work, so it's
Yeah.
possible.
Yeah. I don't
Yeah.
want to be like, oh, 45, but I can't do anything anymore.
No, you don't want that. No, for sure. Okay, well, thank you
Thank
so
you,
much for your time
Eve.
today.
Yeah,
Yeah.
so and then yeah, for sure I'll get the link and then I just follow the link with the payment, right?
Yep.
And that's it.
Yep.
Yeah,
Yeah.
perfect. Yeah,
Okay.
thank you so much.
You're welcome. We'll see you
Have a great
soon.
day.
Thank you.
Bye
Bye.
bye.